name is Megan Duro, and I am a member of Radical Public Health at UIC and a candidate for an MPH at the school. And I'm really, really happy to have all of you here with us and with our panelists today to talk about fat liberation as shared liberation. Before we move on, just a little bit about what Radical Public Health is, since I realize it might be a total question mark for some folks. So quick overview, it's a collective of students, alumni, faculty, staff, and community members that seeks to address the systemic underlying causes of public health challenges and consider more radical solutions. So fat liberation is one of a handful of working groups we have, and we're really excited to be here to talk about it with all of you and with our panelists today. Next slide, please, Caroline. Beautiful. So a couple of just quick community guidelines for the event today. We have a more comprehensive document together about this. If folks are able to take a quick look, I'll drop it in the chat right now. But in general, we know this is a topic that can be pretty complex and bring up a lot of different feelings and responses. So we just want to make sure this remains a respectful, safe space for everyone involved. Caroline, I think you stopped sharing. Oh yeah, you know.
I accidentally opened the community guidelines.
You're good. We can still see the screen. We'll just,
okay, well,
that's perfect. This is letting everyone take a look at the guidelines really fast.
Where's the present button?
It's under share or upper right corner.
There we go.
Beautiful.
Thank you.
And obviously there's the QR code there. Okay, next slide, please. So Zoom controls. I realize we've all been in Zoom world for so long now, but as just a quick reminder, we do have a lot of people on this panel and we want to make sure everyone gets a chance to hear our speakers. So please stay muted for the whole event. If you have questions or comments, absolutely drop them in the chat. We have a handful of folks on the team tracking those, and we are going to have 30-ish at the end of the session to dive into all of those questions. So please drop them and we'll make sure we get to them. And with that, oh yes, I forgot about this. So I know many of you who probably saw our flyers know that we originally had 4 speakers slated for this. Unfortunately, Sydney had some very positive things happen for them, but they unfortunately can't join the event anymore. That said, we still have Dr. Peralta and Virgie and Autumn. It's going to be a wonderful conversation. And now I will introduce those speakers. So some quick overviews of who you're going to be in conversation with today. So Autumn Miller is a scholar activist of fat studies, abolition, and racial capitalism. As a PhD student in gender and women's studies, her research centers around framing anti-fatness as key for the maintenance of the state overall. Dr. Monica Peralta is a Nicaraguan born and based physician, diabetes educator, and certified counselor specializing in intuitive eating, mindful eating, and body liberation. She leads a private practice where she offers compassionate, weight-inclusive care. And Virgie Tovar is a plus-size Latina author, lecturer, and leading expert on weight-based discrimination and body positivity with over a decade of experience. She is a contributor for Forbes.com, where she covers the plus-size market and how to end weight discrimination at work. And with that, beautiful, Caroline, on top of things, we can pin our panelists and get into, oh, and me, hello. Dive into our first question, which I am going to kick over to Virgie to kick us off here, which is just before we get into the meat of the panel questions, is there anything else about your bio or your background that you want to add for our community to know today? All good.
Okay, great.
There we go. You got it.
Perfect. Fantastic. Yeah, I mean, I've written a few books on the topic, including the book You Have the Right to Remain Fat. And that came out in 2018. And also when I was very early on in my work, I did an anthology called Hot and Heavy Fierce Fat Girls on Life, Love, and Fashion. And that was like 2012. So yeah, I mean, the kind of just kind of writing has been a really, really important and big part of my work. And that's all that I was going to add. So thank you. I'm so glad to be here.
Yeah, thank you. Dr. Peralta, I'll hand it to you next. The mute button is no one's friend today.
Well, nice to meet you. My name is Monica. I don't have anything to add to my bio. I think you did an incredible job, Megan. You make me sound nice, so good. Well, for answering the question, what does fat liberation means to me, is both personal and political. It's the fight for a right to exist in fat bodies without shame, punishment, or surveillance. And I wish I could say there's no fight, but as a fat Latina physician, I've seen how fat phobia isn't just personal bias. It's embedded in our health systems, our institutions, our culture. It denies care, it blames bodies, it causes harm. So for me, the center of fat liberation means rejecting those systems. It's not just about pushing back against diets or diet culture or weight loss. It's about undoing the deeper story that says fatness is failure. It's about building a world where bodies are not judged by their size, but instead we could honor our complexity as human beings, our ability to feel joy, our wisdom, our humanity, that I think we are lacking of humanity so much right now in the world.
Yeah, absolutely. Autumn, I want to hand it to you to get a chance to, add anything to your bio and just build on Dr. Peralta there. If there's what does fat liberation look like to you?
Yeah, thank you so much, Megan, for that question. And thank you to my wonderful colleagues at RPH for organizing this and for moderating. Also, thank you to my co-panelists. I'm really honored to be here today. I don't have anything to add to my bio. My name is Autumn. I use she, her pronouns. So my approach to fat liberation is both kind of in my role as a scholar and also kind of my like lived experience as a fat person, especially someone who's on the like larger end of the fat spectrum. Um, to me, fat liberation is a revolutionary social movement that's rooted in the belief that fat bodies have inherent value. It challenges how capitalism and the state view bodies as machines for work and productivity. Um, Fat liberation to me is recognizes that anti-fatness is produced and implemented through other power structures like anti-blackness, colonization, not unlike what's happening in Palestine right now through genocide, capitalism, particularly if we think about how anti-fatness is employed as a mean of kind of managing and regulating populations, especially through discourse around kind of like anti-obesity intervention, or most recently kind of the billion-dollar weight loss industry, and how corporations that are producing weight loss medications are marketing this idea, this like very terrifying idea of like eradicating bodily diversity. Um, all of our bodies hold ancestral memories and legacies of joy and survival. For example, as a fat Jewish woman, my body is a gift that was passed down from my ancestors who survived pogroms and famines. It's kind of a testament to the radical kind of like anti-capitalist Jewish legacy of being a diasporic people who defy state legibility and state aspirations. I think fat liberation affirms that health is multidimensional. It's not a moral obligation or a measure of anyone's worth. At the same time, fat liberation simultaneously kind of disrupts the like weight normative health paradigm that falsely equates weight with metabolic health or health related behaviors. It's impossible to look at someone and tell how healthy they are or what they eat, how much they exercise. Instead, we know that health promoting behaviors like pleasurable movement and eating a wide variety of foods are beneficial for people of all sizes. The real threats to fat people's health are weight stigma within the healthcare system and the overall kind of like stress and trauma that is caused by anti-fatness. Fat liberation affirms that bodily diversity and the existence of fat people are a natural and harmless part of human variation.
Amazing. Thank you. Virgie, I wanted to give you the opportunity to also address what is fat liberation to you?
Yeah, it keeps giving me it keeps having a pop-up that says the host doesn't let me unmute. So
Oh,
that's kind of what I think is happening maybe with all of us. I'm not sure. Anyway, but yeah, thank you for this question. I immediately think about the Fat Liberation Manifesto. I'm going to put a link to it in the chat. And it was a document written by the activist group, the Fat Underground. And the Fat Underground emerged. I kind of want to share a little bit of this story because I think it's so beautiful and interesting. But you know, the very first documented political gathering around fatness, in terms of, you know, fat liberation, fat activism, was in, I think, 1968 in Central Park. And the New York Times actually covered it, and it was called a fat in. And people came with signs and they burned diet books, and it was this really cool, interesting gathering with a few hundred people. And from that gathering, some key people in the history of like some of the history of fat activism, you know, were really inspired. So from that kind of gathering emerged the National Association to Advance Fat Acceptance, or NAFA, which I'll also put in the chat. And NAFA was really about kind of getting equal rights for people in larger bodies. It was an acceptance-based politic. It wasn't particularly radical. You know, it was pretty, yeah, I would say like it was a pretty like you know, a pretty respectability oriented, you know, political organization. And very quickly, you know, NAFA created an opportunity for people to open up chapters all over the country. So you could just open up your own chapter and, you know, they would kind of correspond with you. There was one sort of particularly radical, you know, chapter of NAFA that was mostly women, mostly people who are from the radical therapy movement. And I think, you know, it's a little bit unclear to me from my recollection of kind of reading about that time, but I think I'm pretty sure that almost all of them or most of them were queer women as well. So right away they sort of took on intersectionality. They were very inspired by the Black Power movement. And, you know, like almost immediately NAFA was like, okay, y'all need to like calm down. Like, we're not doing that. Like, we're doing like single issue politics and we're wearing suits, right? Understandable. But then they decided to create their own thing, and it became the Fat Underground. And you can kind of tell even from the name, like it sort of was a bold statement about, you know, what their desires and hopes were. So I mean, anyway, but that's kind of the background of that. The Fat Underground emerged in the, you know, the late 60s, early 70s, and they wrote this document, the Fat Liberation Manifesto. And the demands were very straightforward. So I kind of want to contextualize and say, on the one hand, right, I'm thinking of this document, this is their version of, you know, liberation. And I kind of want to build from that, because really what they're asking for is basic human rights. They're not, I wouldn't say they're asking for liberation. However, you know, I think it says something that they're just asking for basic human rights. But in the document, the demands are pretty simple. Like, we want equal access to medical care, and we want equal pay. We want dignity. We want to, not be scapegoated by the diet industry. And we see our movement in alignment with other oppressed movements, other movements of, agitation of marginalized people. And as you kind of go down the list, you can see how little has changed from 1973 when this document was released to now. And in fact, we're in the biggest push for diet culture, I personally have ever seen in my 42 years of life. I just was looking at the history of diet pills. The first diet pill was in like 1873 or 1893. Anyway, the point is, right, the diet industry is stronger than ever, which is both, interesting on so many levels, which I can get into that later. But anyway, so higher wage people still don't have equal access to preventive medical care. There's still a wage gap between higher wage people and straight sized people. And fundamentally, again, higher wage people are denied basic human rights. So when I think about liberation, I'm thinking, okay, we already have a world where those basic human rights, which we do not have right now, are granted to us, or we agitate for them and we successfully attain them. But I think for me, it's like, when I think about what I'm working towards, I kind of think about, what does it feel like? What does it smell like? What does it look like when the world that I'm fighting for? And it really is a world of like joy and pleasure and safety, for people in all bodies, where it's not, it's not some massive act of quote unquote bravery to like wear shorts if you're in a bigger body. And it doesn't feel scary to want to, find a romantic partner who respects you, where these things just feel like they're given, and they're given to all of us, and bodies aren't used as a way to hierarchize people. They're used as a way to connect. So that's kind of a long answer, but that's my answer.
No, that's perfect. I mean, and I think something I'm hearing across all three of your answers is bodies, period, have inherent value, and shouldn't be, seems so obvious, but shouldn't be judged based on a size or a weight, and which is obviously why we're here today. So thank you so much, all of you, for that. And Virgie, you kind of started to touch on this and the intersectionality of fat liberation, even going back to the 60s. But I'm curious how all of you see an intersection between fat liberation and other liberation movements today or in history. And Dr. Peralta, I'll kick it over to you to start us off there.
I think when we talk about fat liberation, we also talk about fat phobia. And fat phobia, it's not just about body size. It's one expression of carceral capitalist white supremacy system. It punishes bodies that don't conform. It disciplines, surveils, and denies care. So the intersection for me between fat liberation and other liberation movements is structural, because for me, everything is systemic. So we cannot separate fat liberation because it intersects with Black liberation, abolition, disability justice, reproductive justice, decolonization, because it fights the same systems that wants to control and give us this hierarchy of bodies, of races. And anti-fatness is rooted in anti-Blackness. It comes from colonial narratives that painted Black and Indigenous bodies as excessive, unruly, in need of domination. Capitalism reinforces this by rewarding thinness as discipline and punishing fatness as moral failure. And I'm a doctor, so the medical and legal systems uphold it by pathologizing, blaming, and withholding care from fat people, especially those who are also racialized, disabled, poor, or femme. So for me, fat liberation also imagines something different, a world where nobody's punished for existing, where we might replace control for care, where worth is never conditional, nor conditional of a body type. that's the intersection, the shared roots, the shared resistance, shared vision. If we don't confront body hierarchy, we risk reproducing the same violence we claim to fight. Fat liberation isn't an afterthought. It has to be essential on the collective liberation. You know, we all have to fight for that freedom.
Yeah, absolutely. Thank you so much. I totally hear you. You know, I think across many movements today, especially in the States, but abroad as well, we're seeing so much more the idea that you can't exist in silos. These movements can't exist in silos. So I think you're really speaking to that too. Autumn, I want to give the same question to you. What kind of intersections are you seeing across liberatory movements?
Yeah, so I think like I echo everything that Dr. Peralta said. I think about how anti-fatness is maintained and is part of the maintenance kind of capitalism, and how kind of under sort of the intersection of anti-fatness and capitalism, the body is almost like positioned as being this kind of commodity that needs to be like disciplined and managed by medicine. I guess my kind of approach to fat liberation specifically comes from anarchism, which in very specific terms refers to kind of like a non-prescriptive approach to building a world beyond hierarchies, with the knowledge that true liberation only comes from the complete abolition of capitalism, the state, and all forms of hierarchy. In a very kind of like crude way, by the state, I mean this kind of like apparatus of social engineering and domination that erases kind of like previously existing complex relationships and modes of being, including obviously body diversity. Part of how the state maintains its legitimacy is through seeing like peoples and populations as requiring like governance and management, again, often through like body management. Um, I think like kind of now the most kind of some of the most like striking like ways in which I see anti-fatness being used to like maintain the state overall, is if we think about sort of like the marketing for diet or weight loss medications. Novo Nordisk, which is the corporation that makes Ozempic, which I'm sure a lot of people are familiar with, but is like one of the medications that's being like marketed for weight loss and in certain doses. And they have been sponsoring kind of some of these like rhetoric or reports from this organization called the American Security Project, which is claiming that fatness needs to be eradicated because it impedes upon kind of military readiness, or US military readiness specifically. So I think about like what does it mean to frame anti-fatness as like tied to kind of state projects like the US military, which is a source of like massive, death and maiming, and what it means to, like for anti-fatness to be deployed kind of in that way of like as a form of like militarism. I think kind of right now in the current like fascist paradigm that we're witnessing in the US, it didn't kind of come out of nowhere. And it, emerged from like previously existing social conditions and kind of cultural attitudes that are built into like the everyday fabric of the United States, or any state you could maybe argue. The kind of like current paradigm that we're seeing right now with certain person being the head of the Department of Health and Human Services, like I think of that as kind of a result of like decades of so-called anti-obesity moral panic, where fatness has been again sort of positioned as like threatening the sanction of the sanctity of the US nation state by like threatening one's ability to join the military or to be a productive worker. So I think about fat liberation as kind of like very much tied to this idea of like people can't just be reduced to their productivity, and that our goal is not to be workers, and like if we want to think about like opposing violent structures like war and imperialism, we have to think about the important stake that anti-fatness has in those structures, and how fat liberation needs to be a priority for our like anti-war and anti-imperialist kind of pushes.
Yeah, absolutely. You know, I want to pause there and just create space for either of our other panelists if they have reactions or responses to that too, because I think you've raised a number of important points around imperialism on the highest level and just on a more baseline level, just the way we're seeing diet marketing and and pharmaceutical companies buying into this whole structure.
Yeah, I mean, I remember, gosh, I mean, I really love how Autumn brought in the military readiness piece because I think about that a lot. You know, we think about like President Eisenhower was the person who introduced the presidential fitness test, and the whole idea was to begin military readiness, military consciousness in children, essentially, right? Like we have all these athletic tasks, but even I remember reading, you know, something about how even sort of tests about throwing balls, that, you know, how far a child could throw a baseball, was about preparing them for throwing grenades, you know. So I think it's really important to understand that, you know, kind of like Dr. Peralta said, that like this is all part of carceral capitalism. This is part of a military state. This is part of the, I mean, right, like the military is our current iteration of, you know, colonialism. And I think a lot of people think of colonialism as kind of this like old timey thing that happened in the 1800s or whatever. And it just isn't, right? It's reproduced over and over. I have a friend who's a poet, and he says, if your city has a prison, your city is a prison. And I think about, you know, that's, if your country has prisons, your country is a prison, because everything has to acclimate you, body, mind, and soul, to abiding by living in a society like that. So I really want to kind of highlight those things. I was thinking a couple of things that I was hoping to add was, there's this book I absolutely love, which I'm going to put in the chat, called Racial Indigestion, by this incredible scholar named Kilo Wazana Tompkins. It's called Racial Indigestion: Eating Bodies in the 19th Century, I believe. Let me just double check. Yeah, the 19th century. So to me, you know, I love this book, and her work is so just incisive and so good. But anyway, I just wrote a piece kind of in conversation with that book, as well as a few other ideas, called Dieting as a Racial and Colonial Technology of Forgetting, where I kind of write, I'm just going to read a little section from it. So dieting is a technology that co-opts the body via the mouth as a tool to preserve and abstract colonial ideology. It's a practice that was designed to differentiate superior, quote unquote, superior people who denied themselves and their bodies from, quote, inferior people, in order to rationalize things like enslavement and genocide. And I think it's important to understand, right, like the people who created notions that dieting or food restriction was morally, you know, significant and superior. These were people who were like, you know, direct beneficiaries of colonialism. And so I often think, you know, I mean, for me, when I think about the intersections of fat liberation with a lot of other movements, you know, it does really go back to colonialism, white supremacy, etc. But I think what's interesting is like all of these things live as gestures kind of in our bodies, like even our relationship to food, right? Like in this culture, we're taught a relationship to food that is based in terror, control, discipline, and fear. And I find this fascinating, right? Because of course, this maps onto criminalizing and policing the body, which is part of living in a culture that criminalizes and polices things like poverty and racialization. So anyway, I kind of want to go a little bit further, right? How food restriction becomes a way of perpetuating colonialism, because the thinking around food restriction is, because I deny myself, I am morally superior to the quote unquote savages from whom I take life, land, dignity, and freedom. When I deny myself, I disavow or deny my humanity, thereby disavowing my connection to the humans I harm. and I deny my connection to the earth, I deny my connection to animals, I deny that I am not superior, but exactly the same as every other living thing that has a right to live and thrive on the planet, that also must eat to survive. And because I deny myself food, I lie to myself and I tell myself I am better. And because I'm better, it's my destiny to dominate land, earth, and humans. And because I will own and tame and control everything around me, my legacy will live on forever. And right, like, so this is kind of like the moral rationalization. Like, it's important to understand that fat phobia, anti-food sentiments, dieting, etc., all of this emerges. And by the way, some of you probably already know this, like some of the leaders of our, like the historical leaders of what we now know as contemporary food restriction or contemporary dieting, these were men like Sylvester Graham, who invented the graham cracker, who was also a rabid anti-masturbation advocate. He advocated for like extremely, inhumane ways of getting children to stop masturbating. Like pouring pure carbolic acid on their genitals. Like, it was, I mean, so this guy who is like the inventor of the graham cracker, who is kind of the granddaddy of the gluten-free diet, the reason he's called the grandfather of the, he's called the prophet of bran bread or whatever. He had kind of like a moniker. His whole thing with the graham cracker was he thought that leavening and food that had excessive flavor, right? Like, notice the subtle racial nod, right? Food with excessive flavor led to sexual excitation, which, and again, when we're looking at kind of sites of control, the food, the mouth and the genitals are our natural body's ways of interacting and creating cycles of interdependence. These are points of entry, and so the state, must control these sites in order to kind of maintain all this like horrible alienation and garbage, right? But anyway, so Sylvester Graham is like the granddaddy of the gluten-free diet, who believes like yeast leads to sexual excitation, which fundamentally leads to immorality. John Kellogg, who invented the Kellogg's cornflakes, was another huge, what we would call, I mean, basically, these were like the Gwyneth Paltrows of their day. They were like men who had money and influence, and they were able to spread their ideas as pseudoscientific, as quackery as they were, as quackish as they were, and they were trendy, right? People loved going, like John Kellogg had like a sanitarium, like a health spa where people would come. Anyway, all that to say, right, why, when I started learning about these men, also, right, John Kellogg was also an anti-sex advocate. He never consummated his marriage. So why are all these people, who actually are historically better known for their role and their like weird ideas about sex and sexuality, why are they also in the history of dieting, right? And it's because the whole idea of controlling the body, sources of pleasure, areas where there's potential for connection, interdependence, right? These need to be vilified and controlled. And this, and why? Because through that we can justify violence. If we're superior, if we're morally superior, we deserve to live forever. We deserve to take whatever we want. And so I don't want to talk forever and ever, but I just kind of want to end by saying, right, some of these very things that I was just talking about, they exist now in the gesture of food restriction and dieting. Some of the very things that people who are on diets are striving for are the same: moral and physical superiority, distance from the part of us that connects us to the planet and each other, and also, frankly, the quest for eternal life. So, as even though it's been over 100 years since kind of the emergence of our current iteration of diet culture, these ideas still exist, right? And they're more abstracted, and people don't even necessarily realize, but it doesn't mean the gesture isn't understood in the body. Like, even if you don't know that dieting is colonialism, your body knows. And there is no tricking the body,
Yeah, 100%. Oh, go ahead, Dr. Peralta.
I'm sorry, I just wanted to add that, anti-fatness didn't emerge in a vacuum. It was part of the colonial project. It was a colonial tool used to pathologize indigenous bodies. When European colonizers encountered bodies that were larger, fed differently, or moved differently, they labeled them as excessive, undisciplined, and inferior. Fatness became a marker of the uncivilized, something to be controlled or erased. And that logic didn't disappear. It persists today through global health policies, Western medical models, and development programs that treat fatness in the global South or Latin America as a crisis without ever asking whose standards we're enforcing or whose bodies we're punishing. I mean, look at the BMI. It was developed in 19th century Europe using data from white male bodies, but it's now treated as a universal measure of health across Latin America. And our public health systems adopted without questioning its origins or cultural relevance. And as a result, indigenous, Black, and rural bodies that have never fit into that metric are pathologized and policed in the name of health. So if we are serious about fat liberation, we have to be anti-imperialist. We have to reject tools like the BMI, not just because they are flawed, and that's proven, but because they carry the violence of that colonial logic. It means we have to unlearn that logic and build health systems rooted in autonomy, not that control that all these Western health systems want us in.
Absolutely. Autumn, I'm seeing your heart reaction and wondering if there's anything you wanted to tack on there.
Yeah, I mean, I think both of those points were really incredible. Um, I think, to Virgie's point about kind of thinking about like dieting or food restriction as a way of like distancing the body from nature, from animals. I think about kind of like how a lot of kind of like decolonial worldviews and kind of like decolonial perspectives on nature have really pointed out that like we are not separate from nature, and part of like how the like ideology of colonialism has operated has been through trying to like distance humans from nature, or like create this idea of like hierarchies of beings. And I think it's really important to think about anti-fatness and dieting and like intentional weight loss as part of that, as a part of kind of like disciplining the body away from like its natural state, and like disciplining the body like away from kind of from animals, and away from like other beings. I think also, to like Dr. Peralta's point, there is no anti-fatness, or sorry, there is no fat liberation without decolonization and without like imperialism. I think also about like I need to do more research on this, but I know that like there's been this in kind of like the moral panic around fatness, there's this like myth of a quote unquote like global obesity epidemic. And like, I mean, that is unsurprisingly coming from a lot of like Western health quote unquote authorities, and and from my understanding, that kind of like measure of health is being like imposed on kind of the global South in ways that again kind of continue the legacy of like Western extraction from the global South. Maybe Dr. Peralta can speak more to that or has more knowledge on that, but I think I think it's important to think about the concept of like a quote unquote global obesity epidemic and the moral panic around that being used particularly as another way of like reconstituting like the global structure of colonialism and extraction.
Yeah,
Is it
absolutely.
possible to add one more
Yeah,
thing?
please.
I mean, this is something I've been thinking a lot about recently, because one of the things that I've found really, very troubling is that GLP-1, producers of GLP-1s are using the phrase obesity is a disease as their number one marketing phrase. And I think it's really important to kind of talk about that, like, again, disease. And I just kind of want to share this because it's one of those things where I'm like, this is such a soundbite opportunity. First of all, like that these companies are inundating the population to the point that they're gaslighting people, to the point that they do not care about harm that they're creating. They do not care about the correlation between food restriction becoming a runway to an eating disorder, which is one of the most deadly mental illnesses. I mean, there's so many things that are just like, in so many ways, right? Like colonialism and the project of colonialism is nihilistic. Like, and I think what's interesting is that it in some ways, right, there's a hierarchy of bodies, certainly, but there it's anti-humanitarian at its very core. And I always think about, like, I think about the very earliest settlers, quote unquote, in the United States were sent literally with the expectation that they would die and become compost so that the earth would be arable for farming. So I just kind of want to, like, I mean, I think there's like something just so bone chilling about that, but anyway, I wanted to share, like, I wrote this piece, and it was about how we need to stop letting the phrase obesity is disease scare us or affect how we decide whether we want to be involved with this kind of medication. And I kind of wanted to highlight a few things, and it's connected to intersectionality, right? So first of all, like, the American Medical Association recently classified obesity, quote unquote, obesity as a disease. This decision went against the literature review. It went against the data. It went against the advice of its own public health and science committee. And it sparked a lot of discussion and discontent in the health care community to begin with. And I kind of want to say, right, like, every marginalized, like, literally, if you are not a wealthy, able-bodied, like, white cisgender man, your existence has been and will be medicalized. So literally every single marginalized group throughout history has been medicalized, pathologized, considered disease before activists in those communities agitated to have their identities demedicalized. And I kind of want to share some quick examples. Like, for women, it was the medical classification of hysteria, which had to be, quote unquote, treated by doctors. What were the symptoms of hysteria? Reactions to stigma. They were listlessness, bouts of rage, a sense of like irritation, irritability, right? When we're looking at the history of queer people, the psychiatric classification of, quote unquote, homosexuality was developed. And the treatment for quote unquote, homosexuality was, electroshock therapy, also very cruel and anti-humanitarian. For BIPOC, it was the creation of the study of phrenology, assessing the size of people's skull in order to prove, quote unquote, that non-white people were measurably, air quotes, inferior. And for fat people, it's, quote unquote, obesity, which must be cured through methods we know don't work long term, and that I would argue are cruel and unusual. Like, I mean, I can't, for me, I keep waiting, like, especially at, in 2024, when GLP-1 started to really, really get aggressive with the marketing and kind of take over the news cycle, I kept waiting for the alarm, the concern from, reputable outlets like the New York Times, sort of be like, hey, these guys are proposing eugenics in their marketing. Like, aren't we all terrified? And instead, what they did was they hopped on board on the fat phobic project of trying to throw body positivity under the bus and portray this movement as inherently toxic. And so I just kind of wanted to contextualize, right? Like, every single marginalized group has, just like fat people, and we're not out of that, right? Like, trans people are still in this. There's so many groups that are still deeply medicalized and oppressed vis-a-vis medicalization. Right. But it's important to understand that this is part of how this system of colonialism, misogyny, white superiority works. They work in collusion, right? And the medical system colludes with sort of societal norms, societal hierarchies, in order to maintain and monetize these anti-humanitarian projects. Thank you for like, that was like, I'm going to share the link to the piece where I talk about all this. So that's all. Thank you.
Yeah, thank you. I mean, I think that context is incredibly helpful, and incredibly relevant to what we're talking about here, and actually gets at, the need, obviously, to do something about it. And I'm sure a lot of people on this call today are curious, like, for all of you, what do you see, or what can providers and public health scholars and other scholars and educators do to implement like actual changes in their work to push for, yes, fat liberation, but I mean, I think we're talking about so many liberatory movements that all coincide here. So what kind of changes do you guys want to see? What kind of changes have you seen in action that work? You know, what guidance would you offer essentially? Dr. Peralta, I think I'll start with you because I'm curious, especially from a medical perspective, where you're coming from.
I think from, you know, a physician POV, implementing fat liberation starts with asking a different set of questions that we're asking right now. Not how do we make fat people thinner, because I think that's what we are always asking ourselves, but how do we make systems safer, more just, and more responsive to everybody? For providers, it means moving beyond weight neutral language and into actual practice that resists weight-based assumptions. It means learning to sit with the discomfort, to unlearn pathologizing instincts, and to see fat patients as whole people, not problems to solve. Because I think, you know, this weight neutral world and the weight neutral approach, it's going for me in the same route of body positive. Like, yes, all these beautiful words, cute words, and weight neutral language, but then into the actual practice, once you're practicing, we are still doing weight-based assumptions. We still don't have the instruments for everybody. We don't have clothes for everyone. So, you know, in our clinical practice, we have to focus on restoring trust, body trust, but also trust in the provider. The patients are not trusting their provider. We do not have a provider-patient relationship. That means not using weight as a shortcut for health, not prescribing restriction as a default, and understanding that trauma often lives in the body as silence or resistance. Fat patients are often labeled non-compliant, when in fact they are protecting themselves from harm. And I can give you one example. I had a patient who hadn't been to the doctor in 6 years after a traumatic experience of being weighed and shamed during her pregnancy. And when she came to me, we didn't talk about her weight. We talked about how her body was doing now, what she needed to feel safe in that room, and what support she wanted for her health on her own terms. That's what liberation-oriented care looks like, starting from trust and choice, not from assumptions. And we as physicians love to, you know, assume we know everything or we know more than the patient. And that's simply not true. And my hope also for public health scholars, it means, you know, you have to name anti-fatness as a social determinant of health. Right now, fat people, we are studied, surveilled, blame, but rarely centered or protected. We need research that starts from fat people realities, not from fantasies of prevention. That includes, we have to collect qualitative data, challenging the BMI, questioning the goals behind population level interventions that are clearly not working for anyone. And if I can say something for the educators, it's about decolonizing the curriculum. Who defines health? Who gets to be the expert? Whose bodies are always the before? I tell my students when I'm giving workshops and my colleagues, if you're teaching about health disparities without talking about fat phobia, you're leaving a huge part of the story out. And when you work through a fat liberation lens framework, it invites you to imagine new ethics. And this is about ethics of care. One grounded, not in control, but in consent, autonomy, patient independence. And I truly believe that when we create spaces that are safe for fat people, we create spaces that are better for everyone. And you know, this is not about making people more body positive or about changing language alone. This is structural, this is systemic. We have to ask who benefits from keeping fat people afraid, ashamed, and constantly trying to change themselves. That's the level where transformation has to happen, you know, to make an impact on on the actual structure of the system that we're working right now. Sorry if I went like.
No, no need to apologize at all. That was 100% just to retweet everything you said, to be honest. Autumn, I want to give you, oh, Virgie, I saw you move your hands. Do you want to go next? And then we could, okay. Autumn, I want to give you the chance to answer the same question.
Yeah, I mean, again, I second everything that Dr. Peralta said, but I think kind of importantly, um, a lot of times there's this assumption, at least in my experience, that fat people, especially like fat studies scholars or fat activists, that it's like our obligation to be doing like fat liberation work and advocacy. And I really want to challenge that. Thin people, especially like thin healthcare providers, public health scholars, have just as big, if not a bigger responsibility to engage in fat liberation. That work shouldn't only fall on fat people. I think it kind of importantly, it's really necessary not to be able to like oppose kind of authoritative figures or like institutions that are espousing weight loss or anti-fat discourse, like my comrades in RPH are already doing. And obviously do that strategically, but I think it's really important to like have that kind of awareness. I think kind of similarly, like kind of to Dr. Peralta's point, when health providers think about what it means to be like maximizing health, we need to reframe health not as this like one kind of target that we hit, but as this very kind of like amorphous concept that looks really different for everyone. Kind of in that way, I think that like people on the fattest end of the spectrum experience some of the worst kind of like cruelty, weight bias, and like access barriers. They should be centered and affirmed the most in like weight inclusive healthcare. Even sometimes in like fat positive spaces, I see like people on the smaller end of the spectrum being like centered with the erasure of like people on the fattest end of the spectrum happening. And I think it's really important to kind of combat that. I think also like as we need to affirm that fatness is a natural and harmless part of human diversity and variation, we really need to get rid of this like very harmful idea that fatness is kind of like the tragic result of either trauma or like food apartheid. Even sometimes like comrades that I have whose politics I otherwise like respect will be espousing this myth of like fatness as this result of like the capitalist colonial food system. Food apartheid is obviously a massive problem, but when everybody has access to food and when we think about kind of like food autonomy, and everyone having access to a wide variety of foods and reclaiming like food and like the food system away from like a grocery store or other kinds of enclosures like a food bank, people are going to be all shapes and sizes. I think also kind of like to Virgie's point, right now there's this very I would say insidious form, or maybe not even insidious, but just this like maybe kind of like newer form of anti-fatness that's being pushed by corporations that are making GLP-1s. That's this idea of like quote unquote like obesity should be like we should have compassion for fat people because obesity is quote unquote a like pitiable disease. And a lot of that rhetoric is again rooted in this desire to eradicate bodily diversity, and is not backed by medical science at all. Especially if like we think about even like sometimes like efforts to kind of like uh or not abolish but like change BMI are coming from these like weight loss industry astroturf organizations like the Obesity Action Coalition, where they're like, oh, so we shouldn't measure fatness based on BMI, but we should measure it based on like waist circumference or like body fat percentage. Like that's still a way of like pathologizing and saying that fat bodies need to be eradicated. So I think it's just important to think about ways in which anti-fatness is like morphing to fit kind of our current era and like have a toolkit to be able to like dismantle and challenge that whenever possible. I think kind of finally there's this, like, I see this a lot recently, especially when it comes to like GLP-1s and like conversations like, can you be body positive and still lose weight? And like, I'm not interested in like, and I think everybody, or maybe not everybody, but like the vast majority of people in fat liberation spaces do not care what anyone else does or doesn't do with their own bodies. Um, and we're not interested in like judging anyone for, you know, losing weight or doing anything with their own bodies. But I think it's really important to push back against this kind of like neoliberal rhetoric that centers weight loss as like a personal choice without considering like the context in which we make those choices. Um, Especially if we consider like how long-term weight loss is not sustainable, and weight cycling is associated with like so many negative health outcomes. You know, a lot of the like negative health outcomes that are associated with fatness or correlated with fatness may actually be due, or not may, probably are actually due to weight loss and the impacts of weight cycling. So I think instead of like asking this question of like, can you be body positive and still lose weight, we need to ask the question of what are the like larger social conditions that tell people that they need to lose weight, that they need to restrict food in order to have decent health care, to be believed as, you know, like to be believed as survivors, which like I've been assaulted and I've like not been believed as a survivor, or like, you know, or to have like access to social support. You know, what are the broader kind of like social structures that make those conditions possible? So I think, I don't know, I think that's something that is really important right now for providers, because sometimes I hear providers asking like, well, what do I do if a patient tells me that they want to lose weight? And I mean, I think we can affirm that that's a valid and understandable desire, but I think if you're a medical provider, you have an obligation to tell a patient like, you know, you can do whatever you want with your body and I'm not going to judge you, but also the medical evidence shows that long-term weight loss is not sustainable.
Yeah, absolutely. Thanks, Autumn. Virgie, same question to you. What do you think providers, public health scholars, and educators could do?
Yeah, I mean, I've been working with the San Francisco Department of Public Health for the last few months on, you know, bringing weight neutrality to some of their education programs. And it's like, and I think it's really helped me understand sort of the struggle of public health being embedded in that environment. I think kind of like my top level notes are like, you know, you're allowed to take a stand, figure out your values, and stand by them. And if, you know, if like universal humanitarianism, if body weight neutrality, if they're not only values, they're evidence backed, you know, stances, right? It's okay to figure out what your values are and stand by them. The next thing is you need to tell your stakeholders what your values are. So and figure out how you're going to do that. Is it going to be through meetings? Is it going to be on your website? Like one of the things that that when we got to this question, with the team, one of the people on the team decided one of the ways she wanted to do it was she wanted to design all these cool posters that literally she put all over her office. So if you come into her office, you are absolutely going to see a sign that says, you know, health outcomes improve whenever there's less stigma. There's going to be weight neutral messaging and body positive messaging when you enter her office. So like that's how she's advertising. And that's very authentic to who she is. And she loves like bright colors. And so that's like, it's very genuine to who she is. And I often encourage people like, find your voice and find your footing. If you're someone who like loves to make cute posters, make cute posters. Like if you're someone who loves to have hard political conversations, have those conversations. If you are the best at writing an email that really conveys meaningful information really well, do that. And then I think finally, like in terms of like the top level notes, you don't have to be perfect. You don't have to be an expert. You don't have to be at the level where you're doing like media hardball training. I think a lot of people think because there's so much vitriolic anti-fat attitudes that in order to combat that, you have to be like offense, defense, offense, like, you know, like you don't have to be a professional tennis player in the theoretical sense to be able to take a stand and say all health outcomes improve when stigma decreases. Period. Like, if you care about the health of anybody, you're going to be fighting to end the stigma that's absolutely impacting their mental and physical health. So I think, like, you don't have to be some kind of professional speaker to be able to say that, nor do you have to be a professional speaker to have a value and take a stand, right? So I kind of, those are like my top level notes. In terms of kind of getting into it, I kind of want to build a little bit of scaffolding into that, because I want people to know that ending weight stigma has both a very, very strong humanitarian case, but it also has a very strong data and evidentiary case. And I want to say a few things about that. So to begin with, like I said, health outcomes always improve when there's less stigma. For example, we know that we have this research on fat women. We know that plus size women who have lower internalized weight stigma have better health outcomes than women of the same weight who have high internalized weight stigma, indicating that stigma plays a major mediating role in mental and physical health. The next thing I kind of want to share, and again, I'm building up kind of the scaffolding is evidentiary, because this field is so based on like evidence-based approaches, right? Which I completely understand. So I remember a moment in my own early research where I came upon the finding that I'm going to share with you, and it kind of like blew my mind. I remember sort of like pushing back from my laptop and just being like, I need to think about this for like 2 whole days. And the finding was from a 2020 paper that came out in a journal, and it said the health assumptions rest upon health policies rest upon the assumptions that 1, higher body weight equals poorer health. 2, long-term weight loss is widely achievable. And 3, weight loss results in consistent improvements in physical health. And they go on to say these 3 assumptions underlying the current approach are not supported empirically. And so it's like one of those moments where you're like, these are the table legs of medical fat phobia, and they're not empirical. Right? Like a little bit, like, I think what's wild is like when you start to get into the research, because fat phobia is so strong in medicine and culturally, you begin to see how sloppy a lot of the research is. Like, there's false equivalencies, there's all kinds of like attribution error, there's all these problems because the fat phobia is so deeply mediating how people are doing research. To continue, I think public health scholars and educators need to understand that I think that, the medical sector and the public health world in general are often looking at the wrong data and looking at data they have incorrectly. So, for example, this is where like kind of attribution error happened, right? We have data that shows that thin people live longer, healthier lives. However, we also have data that shows that trying to turn a fat person into a thin person not only doesn't work, but leads to harm. We also know that stigma, again, is a major mediating factor. So it's kind of like saying that we know white people live longer lives than Black people, which is still true today, right? And it's like saying it must be something inherent to being in a racialized body that leads to these outcomes. Of course, it's not being in a racialized body. It's because the systems, make being a racialized person extremely difficult and in ways that harm affect longitude, affect lifetime, life expectancy. Also, right, like weight stigma has been correlated with shortened life expectancy. I just have a couple more things that I want to share and then I'll stop. But fundamentally, I think one of the biggest things is our current cultural approach kind of allows us to write this like blank check. A fat phobia gives medicine this blank check where it's like, okay, we started creating diet pills in like in the 1800s. That didn't work. It's been over 100 years. But you know what? Everybody who's been treated like a guinea pig, it's all collateral damage, not a problem, because we're going to find the quote unquote solution to fatness eventually, right? And this kind of blank check writing is extremely morally hazardous. No one gets a blank check. Medicine doesn't get a blank check. Public health doesn't get a blank check. The idea that I think the fact that we're like in this era where fat phobia just is allowed to go unchecked, because eventually, quote unquote, we'll figure out how to eradicate fat people, it leads to all the harm, so much harm to people in larger bodies and beyond. All right, I think I have one last thing. Okay. Oh my God, I have 50,000 things. I'm going to end with this. So weight loss, like the idea of weight loss, which I think is this false equivalency that, like, because somebody can be starved and lose weight in the short run, doesn't mean that they can, like, maintain that, right? And the idea that starvation is a totally acceptable option. And finally, kind of bringing back the intersectionality, who's really taking, for example, GLP-1s? We have all these celebrity faces we think of when we think of GLP-1s, but the actual majority user are women of color. So for me, it goes back to, why is our culture so deeply not only comfortable, but excited to celebrate women of color being starved medically? And how is there no commensurate response from the communities that are supposed to care about this? And not only just, like, I think it's every human's job to care about this, but why aren't the communities whose job it is to protect health and to do no harm totally fine with, medically starving people who are marginalized? Anyway, I'm going to end there.
No, I think that's actually a wonderful point to end on, because it really speaks to everything all three of you have been saying this whole time. It's like these structural issues are baked in, and to the point where people aren't even realizing that there are structural problems, or that people aren't even realizing, oh, this is actually impacting women of color, people of color, more than anyone else, because we're almost blind to it at this point. So I think that's a great concluding point. Thank you all so much. I do want to lift up a couple of the questions we had in the chat throughout for all of you, and I'll drop them in the chat as we go along. So the first one here is, in Latin America, I see a lot of thin, white, or ex-fat people in the spotlight as, quote, fat liberation activists. I struggle with it as I see it similar to white feminism, very performative and not inclusive. What are your thoughts? I'm wondering if anyone, yeah, Dr. Peralta.
Thank you for naming this, because it's not just something I've noticed, it's something that cuts deep. When fat liberation gets filtered through thinness, whiteness, or post-fatness, it starts to mirror the same failures we've seen in white feminism. It becomes digestible, marketable, and deeply disconnected from those most harmed by anti-fatness. It centers visibility over justice, branding over redistribution. In Latin America, this isn't just a coincidence, it's the result of larger systems: colonialism, colorism, classism, and Eurocentric beauty ideals. The people who get visibility in fat activism spaces often already have access to safety, to whiteness, to thin adjacent bodies. And that matters, because it's not just about who's speaking, it's about who is believed, who is resourced, and who is protected when they speak up. Meanwhile, we have fat, Black, Indigenous, brown, trans, and disabled people, especially those who remain fat, are still being silenced, surveilled, or forced to perform respectability just to survive. This movement didn't begin in comfort. It was born from discomfort, from grief, rage, and refusal. So when liberation gets rebranded into self-love slogans, influencer aesthetics, or these corporate campaigns, we have to ask, liberation for who? And that's so important in Latin America, because your discomfort is not a distraction, it's data. It's an invitation to dig deeper, to build movements that are accountable to the most marginalized, to remember that fat liberation isn't just about feeling better in our bodies, it's about dismantling these systems that told us our bodies were run in the first place. And I think that's one of the hardest works right now in Latin America. And You can see it all over social media. And we're only gonna move forward if we're willing to confront not just fat phobia, but the whiteness and classism and colonial logic embedded in how we fight it. And sometimes I think that because we are in Latin America, we think we don't have to fight that whiteness or that classism, and it sometimes get lost and in the message that we're trying to get out there.
Autumn, I see your hand up. Do you have
Yeah.
comment or question? Please go for it.
Yeah. I mean, I want to snap every time like my co-panelists speak. I think kind of, I guess, similarly in terms of like, I can't speak to a Latin American context, but with this like what I mentioned before, with this kind of like constant like obsession that I see of like, can I be body positive, or can I support fat liberation and still lose weight, and this like harping kind of on individual choice. Again, I do not care what anyone else does or doesn't do with their own body, but like in that kind of like obsession with individual choice that is not focused on kind of like structural change or transforming like the social conditions that, you know, tell people that they have to lose weight. I feel like I also kind of see the erasure of like larger fat people or people on like the fattest end of the spectrum who, you know, like have no interest in weight loss or have no interest in like normatively like performing, you know, health. And so it's like, why is the choice of like, you know, smaller fat or like thin white people, like why is that being centered? And I think that just again speaks to kind of like the faultiness and the flimsiness of like the individual choice framework. um I think also, you know, like I I just struggle with the idea of like, you know, kind of as Dr. Peralta said, like fat liberation is not like about feeling good. Or I mean it is, but it's also, you know, not like, it's not like, it is not concerned with like, it's about massive structural transformation and, you know, anti-capitalist, anti-colonial, black liberation aspirations. It's not about like, you know, you get to wear a bikini kind of thing, which like cool, but I think that's a very like reductive kind of understanding of fat liberation.
Amazing. Thank you both so much. We have another question from the chat that says, and I'll put it through the chat here. There's a lot of pushback in public health and medicine that BMI should still be used, despite, as we've mentioned here, the fact that it's a flawed metric, because it's the way to collect data on a component that they see as importantly tied to health. What non-weight focused metrics would you recommend folks use or advocate for if there's a need to collect data to inform health?
I mean, I want to hop in here because one, you know, the answer that I have is interesting because I think it's like anathema to this idea that patients can't be trusted, right? Because, but fundamentally, let me, I'm bearing the lead here. So like one piece of research we have is that when you divorce weight from health promoting activities, the behavior is likelier to be adopted long term than if it's tied to weight. So if you're using weight as a decoy metric of trying to measure whether a health behavior is working, which again, if this goes back to kind of the sloppiness that I was mentioning earlier, why in the world would you use weight as a metric to determine whether or not a healthy behavior is being adopted and it's effective in creating like, you know, someone having a better life, right? And so fundamentally, going back to that data point, right? So we know that when we don't have that metric, that people are actually adopting healthy behaviors, quote unquote. I mean, right? Like we can problematize that phrase, but like I think I kind of mean that in that innocuous, as innocuous as it could be, in that public health framework. And so what this means is that it means asking the patient, right? Like, I mean, I think there's a little bit of it's a switch from quantitative to qualitative. And I think, you know, as someone who went to grad school and like got my fair share of people saying really, people having this feeling that qualitative data isn't trustworthy. It goes back to this anti-humanitarian, hierarchical, the doctor needs to have needs to have like an objective measure because the patient cannot be trusted. I think this is what's so challenging, right? Because I think they're like, not only are there qualitative ways that you can assess, is this person doing this behavior because you ask them and you trust them, right? So that this like involves this mutuality that is not really part of, you know, like what we think of as respectful medicine, right? And to a certain extent, public health. The other thing is, right, if you really want, like, I think there are other objective, I feel like I'm like, I don't want to tread too far into like the medicalization side of things, but I just think about, like, for example, if you are really worried about, someone managing a chronic condition and like having these certain modifications is going to help them manage that condition regardless of weight, what is the metric that is most connected to monitoring that condition? Taking weight out of the equation. So I think what's interesting is, like, there's this idea that BMI captures data that's useful, and I think that we all agree that that is a false premise. So if we accept that BMI is not a reliable, and right, like, even I was mentioning in the chat, Dr. Janet Tomiyama, who's at UCLA and has a lot of research on this, she put out a paper that pointed out that 1 out of every 4 people, when BMI is used as a metric of cardiometabolic health, is misassessed as either healthy or unhealthy. I would call that a 25% margin indicates strongly to me that it's not reliable. So what would it look like to say this isn't reliable? What difference does it make if it's scalable? What difference does it make if we capture very, very quickly this quantitative data, if the quantitative data has like a 25% error rate, right? I think it's important to kind of, again, when I'm thinking about scaffolding, thinking about, is there a problem? Like, where is the problem? Is the problem that I believe fundamentally that weight is a reliable, metric for someone's health? Because that's where we need to start with the problem, right? Is the problem here? Is the problem here, right? Is it structural? Is it intrapersonal? Is it interpersonal, right? And so that's how we kind of deal with these. I'm gonna stop now, but that's my thought.
I will also like to add, if, from a physician POV, if we actually want to collect data that informs health without reinforcing weight stigma, we need to shift our focus entirely. And that means measuring what people do and what they experience, not what they weigh. And I like to see this like in 4 big macro examples: health behaviors, and that is access to food, movement, sleep, stress, not moralized or reduced to lifestyle. Clinical markers like blood pressure, A1C, lipids. If this is medically relevant to that patient, then you have the social determinants: housing, income, discrimination, safety, because those shape health far more than weight. And especially patient-reported outcomes, quality of life, symptom burden, experience of care. Because if people are being harmed or shamed in the name of health, that's not care, that's violence. So yes, move away from BMI, but also ask, why do we keep needing to quantify people's bodies to justify their access to care? That's, I think, the shift that needs to happen.
Yeah, amazing. I have to say, you guys keep saying things that I'm like, put it on a t-shirt. Put it on a t-shirt. I'm like, just 100% to all of this.
I have to just like snap at that, Dr. Mendoza, because like I remember once working with she's an anti-diet nutritionist, a scholar, and she was like, there's this sanctity to health in the West that it's almost like above humans. Like the idea that health is above humans and the pursuit of health is more important than humans. And she's like, if the pursuit of health is not about improving human life, it doesn't exist. I mean, it's not, I think I just kind of wanted to like highlight that because I think this is so important. Like yeah, if something is being right, like, because the whole idea is if we're honoring or trying to maintain someone's health and treating them like garbage, right, what are we actually doing? Like, how is this, I don't, anyway, I just snapped to that.
Yeah, Autumn, please jump in.
Yeah, I think kind of to go off of that, like I think we need to ask questions about like why do we have so much investment in like measuring, like reducing a population quantifiably down to one number, and kind of thinking about that idea of like reducing the all the kind of complexities and nuances of like population well-being. Like, do you have access to food? How is your mental health? Do you have access to housing? You know, are you able to like move, like engage in pleasurable movement? You know, like, are you, you know, worried that like your family is going to get bombed, or that you're going to be like incarcerated or deported? You know, I think also like, and I, you know, I, how do I say this? I don't mean to be completely like casting dispersions on, I guess, like quantitative research methods, because, you know, in the case of patients, like I think there are like, or in the case of like healthcare providers, I think there are so many quantitative ways, like, or quantitative, I guess, measurements that are not weight or are not like body size focused, like blood pressure, A1C, other kind of like lab results, or, you know, like X, or like if someone breaks their ankle, like there are so many different, um, you know, like results or like ways to measure that are not weight. But I think also kind of about kind of like ways that quantitative measurements is used by the state as, again, ways of kind of like governing and controlling populations. Like another kind of example is my understanding of oftentimes like how quote unquote like successes of global health are measured are like what percentage of women in the global south like are on a contraceptive, for example. So obviously there's a lot of like very concerning like eugenicist under or like overtones there. And that's not to say that it's impossible to do like feminist or fat liberation aligned quantitative research, but again, I think we need to think a little bit critically about like what is gained from trying to like reduce population health down to one like quantifiable number, and can that even be reduced to one quantifiable number, especially if we think about health and well-being as this like incredibly amorphous gooey concept. And also like there are so many people who may not be able to like prioritize their health, and like why do we see that as kind of the ultimate goal, especially if we think about kind of like a disability justice lens, and how there are so many people of all sizes who have disabilities and chronic illnesses who will never be quote unquote healthy by normative standards.
Absolutely. I don't think we quite have time for another question, but thank you all so much. We do have a couple just quick wrap out, close out things. So, first of all, if anyone is interested in learning more about any of our amazing panelists, you can access their website / bios via these QR codes. And as a final, if you have time, we would love to get your thoughts on how this event went. It just helps us kind of keep track on what folks are interested in and what they might be interested in down the road. I'm going to ask if someone else on my RPH team can drop the link to this survey in the chat also. That would be really helpful. And finally, just a huge thank you to Autumn and Virgie and Dr. Peralta. I hope you guys saw you were getting flowers in the chat the whole time, and this was an incredible event. So we really appreciate you taking the time and sharing all of your experience with us today. And I think we will close it out there. So thanks everyone for being here, and have a great rest of your day. real.
Thank you so much, everyone, for